Hello viewers, and thank you for joining us for this third segment of a series on the Central New Hampshire Medical Reserve Corps, also known as MRC, and the Community Emergency Response Team, referred to as C.E.R.T. Today we'll touch base on the public health model that is unique to New Hampshire. New Hampshire significantly utilizes volunteers and community partnerships to address public health throughout the state. In this segment, we will cover New Hampshire's unique public health framework and how the regional volunteers play a significant part in New Hampshire's public health emergency plan. We'll begin by talking with Angel Ekstrom, the Central New Hampshire Regional Public Health Network Coordinator and Director of the MRC and C.E.R.T volunteer units.
So I'm talking with Stephanie Locke. You're Chief of New Hampshire's Health and Human Services. Thank you for being a part of this series. Of course. In simple terms, can you describe the public health emergency response model from the federal level into New Hampshire and on to our local communities?
Yeah, absolutely. So the federal program called the Public Health Emergency Preparedness, or PHEP model, is through the CDC, or Centers for Disease Control. It's a grant-funded program which helps ensure that communities, states, and tribes and the federal government are able to respond to a public health emergency. And so there's layers of redundancy built into that system to ensure that we, the state of New Hampshire, and our local community partners are able to achieve all 15 of the PHEP capabilities. When we think of PHEP here in New Hampshire, disasters start and end locally. So it's incredibly important that we maintain our relationships with our community partners and ensure that the communities have what they need to be able to respond to a public health event here in New Hampshire. We have 13 regional public health networks here in New Hampshire, which partner with us and partner with other local organizations to help ensure that they're prepared to respond. And one of the major concepts that the RPHNs focus on, those regional public health networks, is the RFE, or the Regional Public Health Emergency Annex. And that's the plan that really drives response activities during a public health event. I want to highlight that it's incredibly important to recruit and maintain volunteers by our regional public health networks, because New Hampshire relies heavily on volunteers to be able to respond to a public health emergency. And so the volunteers get taken under the wings, if you will, of the Regional Public Health Network. They get trained, they respond at the direction of the Regional Public Health Network, and are really instrumental in order for New Hampshire to successfully respond to an event. When the communities need extra support, they look to the state of New Hampshire to fill some of those gaps. And so we have the New Hampshire Department of Health and Human Services, which serves as our lead state agency for the PHEP program, as well as during responses during a public health event. Specifically, we have the Bureau of Emergency Preparedness, Response, and Recovery. We also call it EPR, which oversees all of the PHEP programs here in New Hampshire and serves as the liaison not only to our community partners, the regional public health networks, but also to other state agencies. And so our Bureau works hand in hand both with the RPHNs, the Medical Reserve Corps, the C.E.R.T volunteers, all the volunteer programs here in New Hampshire. We have those relationships to be able to help support that response. When the state of New Hampshire is no longer able to fill those gaps, we turn to the federal government and we look for help from various federal agencies to help fill those gaps. And so if we think during a pandemic, for example, we work very closely not only with CDC, but FEMA, the Federal Emergency Management Agency, and several other federal programs to be able to deploy resources that we, the state of New Hampshire, and/or our community partners don't have. So in order to be able to respond to a public health emergency, it's important that those pre-incident relationships be established, that they be maintained, and that there's good communication bi-directionally to ensure that everyone has the information and the resources they need to respond to a public health event in New Hampshire.
I understand you're the Central New Hampshire Regional Public Health Network Coordinator, or RPHN, and the Director of the Medical Reserve Corps and Community Emergency Response Team units. Can you explain the Central New Hampshire RPHN geographical footprint and framework?
The Central New Hampshire Regional Public Health Network, the RPHN, is a group of collaborating partners and the RPHN coordinator, organized to address public health within the region's geographical footprint. There are no state employees at the regional level within the RPHN. The work is conducted by volunteers and collaborating partners with the support of the regional coordinator. You see here where the MRC a collaborating volunteer partnership, fits into the federal framework.
Angel, can you walk us through what the regional public health framework looks like?
Each RPHN is unique. The Central New Hampshire RPHN, our footprint, is shown here, addresses public health on behalf of the state to serve the 18 communities that make up the region. Central New Hampshire has the Central New Hampshire Partnership. The RPHN and the Public Health Advisory Council, known as the FAC, takes the direction from the Central New Hampshire Health Partnership as shown here. The Central New Hampshire FAC is made up of representatives from local organizations. Our FAC determines Central New Hampshire's public health priorities. Keep in mind that each RPHN has its unique structural model. The Central New Hampshire RPHN has the following regional initiatives: SUD, which is Substance Use Disorder; FEP, which addresses public health emergency preparedness, developing the Regional Public Health Emergency Plan; the Multi-Agency Coordinating Entity, the MACE, a group of individual volunteers from local organizations that are brought together to determine the region's response during an emergency; the Regional Coordinating Council, the RCC, is another group of collaborating partners who work developing the region's public health emergency plan, participating in local and state drills and exercises that practice the regional public health emergency plan. You see the MRC C.E.R.T shown here as well. Here is New Hampshire's public health framework. The region's public health priorities reflect the social determinants of health, such as affordable health insurance, cost of care and prescription medications, affordability and access to healthy food, access to mental health care, substance misuse prevention, treatment and recovery, and domestic violence and childhood trauma.
Angel, you have several titles and responsibilities. Can you describe your job for us?
Simply put, I'm the liaison between the state and the regional partners and residents. I support and coordinate public health initiatives for the public health emergency preparedness. This work drives the region's public health emergency plan as well as practices it with regional partners through drills and exercises. Regional volunteers, they include the Multi-Agency Coordinating Entity, the MACE, the Regional Coordinating Council, the RCC, the Medical Reserve Corps, the MRC, and the Community Emergency Response Team, the C.E.R.T. COVID response, the region continues to identify gaps, connect partners to state entities, services, and so forth, and school-based clinics.
What is Central New Hampshire's public health emergency preparedness mission?
Each region has its own unique mission and goals. Central New Hampshire's is to foster a prepared community that supports healthy lives, health equity, and well-being throughout the region. Regions also develop their own unique regional public health emergency plan with their partners and are responsible for reviewing and practicing their plans. The strength of each RPHN is based on the engagement of the regional partners. The Regional Coordinating Council, known as the RCC, is a group of partners made up of all sectors that develop and practice the regional public health emergency plan.
We have professional leaders of emergency response crews in our region, hospital staff, fire chiefs, police, and others. How do you work the interface with these leaders?
As mentioned earlier, there is a group of volunteers called the Multi-Agency Coordinating Entity, the MACE. The MACE is made up of local professional leaders from throughout the region that are the decision makers on the region's behalf during an emergency. The RPHN coordinator pulls the MACE together when activated, briefs them on situational awareness, and together coordinate the regional response.
Our longest standing MACE member is Chief Heath of Ashland Fire Department. Chief Heath, can you please share your experience being on the Central New Hampshire MACE? Let's start out with, how long have you served as a Central New Hampshire MACE member?
I came on board, I believe, when the organization was first formed.
In your view, What is the importance of partner engagement in developing the regional public health emergency plan?
Well, depending on the nature of the emergency, a single community, doesn't have the resources necessarily to handle large events, large emergencies. And so several communities working together, can find a better resolution and then enact whatever course of action they choose.
And the importance of reviewing and practicing local and statewide public health emergency plans. Can you share a little bit about practicing the drills and exercises?
Well, like anything, you can have a plan, but unless you practice that plan periodically, then people, may not remember how the plan was supposed to go, and so and then sort of sometimes too in a training you will come across ideas that may have become obsolete, and you might want to change them. Perhaps some equipment that's available has appeared, and you can work that into the plan, or perhaps there are other solutions to the problem.
And you have given this community, this region, so much. We really thank you for your service and your commitment.
Oh, my pleasure.
I understand that when the governor declares an emergency response, this can prompt a rapid activation of the regional public health networks. Can you describe how Central New Hampshire MRC and C.E.R.T units are part of an emergency response activation?
There are 3 declarations to determine emergency response. The governor can declare a state of emergency in the event of an imminent and occurring natural, technological, or man-made disaster of major proportions. This allows the governor to exercise additional emergency powers, including assuming control of emergency management, obtaining needed materials or services, and support for the evacuation of populations in a threatened area. Another is the Commissioner of DHHS may declare a public health incident to protect public health and safety when response activities require assistance from non-state agencies. This may be used when the event does not rise to the level of an emergency declaration by the governor. The third is the Secretary of the Department of Health and Human Services may declare a federal public health emergency in response to significant outbreaks of infectious disease or bioterrorism attacks. Activation triggers are when there is a declared public health emergency, the state requests activation to open a point of dispensing, an acute care site, or a neighborhood emergency help center. 2 or more towns in the region request activation, or there is a threat outside of the region that is likely to affect residents within the Central New Hampshire region.
You have mentioned in prior videos that the local MRC C.E.R.T is part of a larger effort in public health. Can you describe MRC and C.E.R.T mission and the recent PH initiative?
Examples of past public health emergency response efforts have been the opioid epidemic, the state public health incident declared in 2015, the Public Health Network offered community education sessions and Narcan distribution throughout the region. Another was hepatitis B, the state public health incident declared in 2018. New Hampshire was one of 33 states that identified hepatitis B as a public health incident. We worked with the mental health professionals, faith-based communities, medical providers, social services, to support the vulnerable populations in offering them hepatitis B vaccination, and COVID vaccination clinics, a federal public health emergency declaration. Non-emergency community response efforts have included school-based clinics and supporting local events such as health fairs, local races, the National Night Out, the Hebron Fair. We offer first aid, traffic control during some of these events.
Angel, what do you say to encourage people to join this effort?
The Medical Reserve Corps, Community Emergency Response Team volunteers, and the organizational partners are essential The Regional Public Health Network could not have the community impact without its dedicated and talented contributors. For those who want to make a difference in our local communities, the C.E.R.T and the MRC is a wonderful way to serve our communities.
Thank you to our viewers and to all of the citizens who contribute to the public health effort. We hope you have gained a little bit more awareness of how the Medical Reserve Corps and the Community Emergency Response Team volunteers fit into New Hampshire's public health model. Viewers can connect with the unit to get further information about the Central New Hampshire Medical Reserve Corps and Community Emergency Response Team units using the information on your screen. Thank you and take care.